take time, but I think that promoting patient information and access to information would enable this kind of application of new policies. Patients will become aware of their rights and will become more capable of defending, championing their rights and their causes, and maybe that will lead ultimately to a full implementation of those new policies and regulations.
I think a lot of countries have started making statements. They want to be patient-centric and they want to focus on value. But in essence, I would say very few really have policies to deliver that. Because a policy would be clear definitions, rules, regulations that enable this change, and very few countries have actually done so. I would say the buzzwords are there, maybe the strategy is there, policy is not there. So policy needs to be coherent on payment models, on how we organize care, and on informatics and data. And unless it is, these enablers are not going to support the change.
I think there are two elements which are important in this question. The first one is making sure that we are able to measure what we are doing. Because if we are not able to measure the impact of the changes that we are doing, then we cannot see if it works, if they create the value that we want to create, and how to improve or to change, to reduce something or to increase some of this. So I think the focus on the measurement for the follow-through is very important. The second element is today we have, as I mentioned, systems which are too fragmented, and we need to integrate them together. So putting the data together, sharing more data, making sure that we are able to understand the outcome over time and not just during a certain period of time is really important.
The first thing will be access to information. The second, ownership of health data. And the third will be shared decision making. If we get used to patients that are engaged and involved in the decision-making process, that would prevent future patients to get lost.
We have like 20% of healthcare expenditure delivering no measurable improvements for patients, so being wasted or ineffective. That is a very powerful rationale. When we're talking to finance ministers, which are obviously concerned about healthcare spending more and more and more, we need to have a much stronger narrative about what gets out of health systems, of the fact that there are inefficiencies that can be addressed and waste that can be cut.
First, making sure that the criteria we are using to evaluate the impact of what we are doing are based on real patient-related outcomes. So making sure that the patient is integrated into the definition of what good looks like for them. Another one is making sure that the incentives are aligned. And third, in order to do that, we need to integrate the patient in all of the steps. So having the patients involved in clinical development, in regulatory, in research, in science, and in commercial and real-life evidence are also very important to make sure that whatever we decide, we will decide jointly with the patient voice heard, and so the result will be better for the patient.
I think what's key is standardized measurements. We need to measure the same thing for an asthma patient, whether the person lives in the suburbs of Brussels or in the downtown Paris. We need to have a minimally sufficient set of metrics. And these metrics need to be metrics that matter to patients, so that we're not measuring something only doctors think is interesting, but something that's relevant for the patients. It should be easy to enter the data into the electronic medical record. It needs to be integrated into the electronic medical record, and therefore integrated into the workflow. But many of these measures also prompts patient-reported outcome metrics. I'd rather than have patients fill in a paper survey, let's have surveys on the smartphone. So you get a survey home, you can fill in the response, and it goes into the registry or the doctor's office. So I think we need technology to support, to make it easy to capture the data, but we also need to have the right metrics in place, and they need to be standardized, globally harmonized, and meaningful for patients.
If we're capable of documenting patient value, we can pay for this patient value. If we pay for patient value, we can maximize the outcome for patients.